So we're joined again live with Dr. Dana Hawkinson from the University of Kansas Health System to answer questions that our viewers sent in on Twitter and our website. These are the things people are wondering about, Doctor.
That's right,
Yeah.
Doctor. One viewer asked on our website, what danger is there to drive around and sightsee right now? Because a lot of people think maybe this is a safe way we can just get out of the house. Is that okay to do?
I guess that depends where you're driving to. Is it an extended drive? You know, all of these things are all about risk and benefit, risk and reward. We know that, sure, if you're leaving your house and just in your car, you should probably be safe, but are you stopping to go to a restaurant, get gas, things of that nature? You're coming then into contact with the outside environment, places that other people have been. You have to take into account those risks because we know that the virus is out there. It is permeated through society. But what is the risk that you pose, that it poses when you go out to these places? Are you stopping? Are you, with high-touch surfaces, such as gas handles or restaurants, things of that nature? That's a very difficult question to ask. It's obviously a case-by-case basis, but certainly if you're just in your car driving around, that should be fine.
Dr. Hawkinson, if not for the weird weather we're having right now, we're at 30 degrees outside right now. This would be the beginning of kind of the spring outdoor season. For a lot of people, that means hitting golf courses again. Golf courses are open right now in a lot of cases around the metro, but they're using modifications. The covered holes, only playing 9 holes. I played last week, and at my local course, they would not even let me bring my 7-year-old son with me to ride along in the cart. Only one person per cart, no matter what. What's your opinion on playing golf? This was one that we got quite a few questions about.
Yeah, we've always encouraged people to go outside and be outside, but do it responsibly. This goes back to the sightseeing question as well. It's risk versus reward. Can you do it in a healthy manner? Do we know that the cart that you're using has been wiped down? Has it been cleaned? Are you using proper hand hygiene? Are you making sure that you are social distancing or physically distancing from other people? I think if you can do it in that manner, if you're using your own clubs, and so we know that those are clean, you don't have really contact with people from another household. I think if it can be done responsibly, it seems okay. It's again, do you want to take the risk?
Right.
Are you going into the clubhouse? Are you going to be interacting with other people there? So all of those types of details need to be taken into consideration.
Yeah.
Doctor, a lot of viewers wanted to know more about the work KU Health is doing amid the pandemic. Can you tell us some more about the clinical trial on hydroxychloroquine that the center is asking for healthcare workers to participate in? Why healthcare workers?
Yeah, well, I mean, obviously healthcare workers, we have a risk that is, number one, the same risk as the people in the community because we are going out to essential places, stores, getting gas, things of that nature, but also there are a lot of healthcare workers, front-line healthcare workers, such as our nurses, our therapists, our physicians who are seeing actual COVID patients every day. So they do have a fairly higher risk because they are seeing critically ill patients. They are seeing, 4, 5, 6 critically ill COVID patients a day or more on the regular floors as well. So although they do have PPE and they are donning and doffing and doing adequate hand hygiene, they still, we think, have a little bit increased risk just because they are around it so much more every day and caring for those patients with known COVID disease.
And that's the HERO research that's being done right now, right? That's what that's called, Dr. Hawkinson?
Yep. Yes, it is. Also, hydroxychloroquine was mentioned for clinical trials. Otherwise, we are also, we have trials going on for treatment of COVID. As I've stated before, there is no actual FDA-approved treatment, so we are looking at other treatment options, including hydroxychloroquine and other drugs in a trial manner for actual patients who have it. But the HERO trial is to help see if hydroxychloroquine prevents disease in people who may have been exposed or in healthcare workers who may have been exposed.
And if you're a healthcare worker and you're interested in taking part in that, you can find a link on kshb.com right now. Dr. Hawkinson, thank you always.